Today's guest is Remi Drozd. I think you'll find this fascinating. This is a subject that we've been thinking of finding out more about, that of the use of ketamine in the treatment of anxiety and depression.
And he has Lucid Therapeutics.
He has Lucid Therapeutics, and we have also today a patient of his who went through this process.
Me.
Enjoy it. But what do I know? I'm just a vagina doctor. Dr. Remi Drozd, welcome to the podcast. It's good to have you here today.
It's really good to be here. Thanks for having me.
So you are the founder, owner of Lucid. Does the word clinic come into it, or just the Lucid?
Therapeutics.
Lucid Therapeutics.
Lucid Therapeutics, thank you. A ketamine clinic here in Santa Barbara. And there are two things we're doing today that's kind of unique for us. And one of them is that we want you to explain why you're doing this, what you're doing, what it is. But secondly, we're going to follow Karen, who's here with us. For our listeners, she's my right hand, and she's here supporting us today. But she had a treatment, a session at Lucid just this last weekend. And I think it'd be really interesting to talk about that.
Yeah, I'd love to talk about that.
So tell us how you got here. What's going on?
How did I get here? Well, I'm an ER physician, so board certified ER physician for 15 years. And what I had the opportunity to witness was a really dense human experience when people have extremists of pain, loss, they come to the ER. So I witnessed all of that, the mental component and the physical component. And so I find that over time, the body heals, but we identified that there isn't much that heals the mind. So trauma is something that happens instantly, and being traumatized is something that you retain. It's an experience that sticks with you for days, weeks, years. And over time, I realized that a lot of people that show up in the ER aren't there because they've had a traumatic event. It's because they've had a traumatic experience. It's within them, and they're using coping mechanisms like alcohol, pharmaceuticals, tobacco, bad eating habits, and creating new physical problems, COPD, obesity. They run out of money, they turn to crime, and they ended up in the ER. And we realized as a medical body that there aren't many treatments for this. And I was fortunate enough to, about early pandemic times, to get involved in a course at Johns Hopkins and see how psilocybin was used to treat mental health, specifically end of life. And I tried some of these treatments myself, and I saw that this was more powerful, more powerful than any medicine that we were using for mental health at the time. And I kind of decided at that time that I'm going to shift towards psychedelics as a healing modality. And in one way, kind of hang up my doctor coat and pull on my healer coat again and try to find this new approach to mental health that it was really underutilized.
And where were you at the time when you decided to make this change?
I'm from New England, so I always studied around Boston, New York, and at the time I was living in Providence, Rhode Island, working in actually a community hospital in Massachusetts, a town called Fall River, and raising a family and kind of being peripheral to these academic centers near Boston, and realizing that this was really, really new, even for a place that has such a high education level like Boston, Massachusetts.
Yeah. And when did you get to Santa Barbara?
2.5 years ago.
With the purpose of doing this?
Actually, no. What happened was I started to do some of this work myself, and it became so expansive. I realized that I needed to step back from medicine. I hadn't burnt out. I still really enjoyed the model that existed, but I identified that the model was very limiting. And became a little disenchanted with the role I was playing in the Western medical system. So I took a sabbatical. And I've done this before. 5 years prior, I took a year off when I worked in Nepal. I volunteered. Before that, I worked in South America. But I take pauses sometimes. So this felt like a really intentional pause to step back. And actually, it was one of those times we bought an RV. My family was young, and we road tripped and traveled. And during one of my road trips, I heard a podcast. During that podcast, someone talked about how psychedelics are so powerful, and they mentioned ketamine. Actually, I had a bias. I thought, ketamine, that's that drug of abuse that I use in the ER pretty frequently, but it just knocks people out. Why would that be something I want to use? But the book I read after I heard that podcast was The Ketamine Papers by Phil Wolfson, and that was very well written, and a true physician articulating these mystical experiences and talking at the same time as like a physician about how the science behind it works. And it opened my doors of perception. And I took a training, one that he was peripheral to in Los Angeles, or near Los Angeles. And when I had my first ketamine journey, it opened my mind in a very big way. And it made me realize that this is as powerful as psilocybin, in some ways more powerful, I believe.
And psilocybin, is that mushrooms?
Yes.
Okay.
And the Brian Richards, the person that was working at Johns Hopkins, he works with psilocybin, which is the magic mushroom for end of life. But ketamine can be used for depression, anxiety, and end of life, for many, many things. And my experience really opened up the realization that not only can I do this, but I can do this now, and it's legal, and it's very safe. And to answer your question, did I move to Santa Barbara for this? No. But now that I'm here, I find that there's a need, that the community is available and responsive to it. And I feel like it's just the beginning of something.
So Karen had been reading a lot about ketamine treatment.
And wait, I mentioned it like a year ago. I'm like, I really want to get someone on to talk about ketamine. I could barely get it out of my mouth, and he's like, no.
Yeah.
Which is my usual response.
Totally.
To anything new.
Yeah.
And so I was like, oh, okay. But I think it's, so interesting and fascinating. But anyway, fast forward, here you are. So it took a while, but I think meeting you, because we had you come to the office one day, and meeting you and talking to you really opened up, Duncan, your mind too. Right?
Yeah, I'd say so. That's true.
Yeah.
Just of a real interest, just learning more about it. I was just ignorant beforehand. That was what the no came from. And then we talked about doing it myself. And I still plan on doing that. But it just seemed to work better in discussions that Karen and I had together, that she would break the ice. And so that happened. And
the Lucid Therapeutics, it's on Milpa Street, but when you walk in the door, you could be anywhere in the world. You're just, I think, you're immediately just taken by the feeling of walking through your door, which is great.
Just so peaceful.
You get in a whole different space just walking in the door there. I mean, that you did such a good job with that.
Yeah, thank you. It was designed and built by psychonauts for psychonauts.
Okay.
We say you can only take someone as far as you've been. So everyone involved in our process believe in psychedelic work, have been transformed by it, and so they can relate to it. It's not like we're designing a dentist's office. You just want a place to sit. Like this, the container that a client walks into, that starts to develop trust with their providers, everyone from the front desk to the person managing your invoices to the care team. We all have to have a certain presence, and so we want the entire space to have that as well.
Yeah, you've done a great job, because it's deep work. Like just my intake with you, and then my next I guess it was a therapy appointment with Shani,
Mm-hmm.
was probably over an hour. I was exhausted after it because we went really into a lot of things. And so the whole process is preparing you for the actual treatment you're going to have. So your space really lends itself to the people coming through the door trusting, which then goes hand in hand with them having a really positive experience while they're there, doing something that's kind of scary, you know? Well, for me, it was. I mean, maybe for most people, it's not.
No, for most people find us because something else didn't work. Most people found us because they trusted their doctor, or they trusted the existing system that kind of helped them in the past, and it didn't work.
Mm-hmm.
So we have to quickly develop rapport, and so they have to trust us. They'll only journey and experience true richness if they can surrender to the strength of the treatment. And so the space and the relationship between myself and you during our onboarding, and then the relationship between the coach that you were introduced to, all makes a significant, or all influence how rich the experience is for you. So it sounds like that was nourishing for you. And that's what we try to reproduce for everybody.
And the sound bath you invited me to, that was great.
Yeah.
Yeah, I loved that.
Explain that a little more. Describe it. I should
The sound bath?
Yeah.
Yes, the sound bath. Well, we're doing a lot of community events. Part of our program, the Lucid Method, the program really looks at, onboarding and getting you to understand, and then getting you to trust and know the care team, and then having this beautiful journey, and then integrating. Integration is to make whole, is to take the elements that were revealed in this powerful journey, and create changes in your life. If your life is the same after a treatment or two, then an opportunity was missed. So we want you to integrate in like the 6 components of your life: the spiritual, the financial, your personal, your relationship with your community. We really break down who you are and what you want to be. And most people, especially post-pandemic, miss elements of community in their life.
Mm-hmm.
So we're doing pretty regular, once or twice a week, community events. So the sound bath was one of the events we're going to start doing twice a month, where in our community space, that could sit about 20. An artist will bring multiple glass bowls, gongs, other instruments that make sound, and create a real, almost like a symphony by herself, and create this beautiful high vibration experience. And everyone there just sits and listens to it. And this is an experience where you don't use medicine. There's no ketamine or other medicines offered, but it truly is, I'll say psychedelic, but it truly is mind expanding, and gives you the sense of non-ordinary consciousness for a brief instant. And more importantly, people can arrive early and have some tea, stay late and talk. And it allows community formation around like-minded people.
Okay, great. Thanks.
Before I talk about my experience, I just want to quickly say, or so our listeners can understand, when people come to Lucid, what are the options for treatment? How does that look for people coming?
So options for treatment are, well, what we offer right now is the only legal psychedelic, and that's ketamine therapy. But ketamine can be an infusion or injection all by itself, or it can be what we offer, and that's ketamine integration therapy. So the way someone engages with us is they meet our team, talk about, ask their difficult questions, discuss their medicines. They do an onboarding with myself, spend an hour really describing what a care plan and a meaningful intentions are around what they want to change in their life. Then they meet the coach. They start doing coaching and really start to build a plan. The goal is for that plan, for us to realize that plan is something they may have had for a long time, but haven't been able to actualize. Then we enter the treatment process, where the 3 of us, everyone in that care team, meet, and they are offered ketamine intramuscularly or IV. And that's much more powerful than doing it, taking troches or nasal spray, which is sometimes offered out of a hospital, because the pharmacodynamics of an intramuscular IM is such that it goes into the central nervous system very quickly. So you're getting low doses, non-addictive doses, doses that can cause side effects, dizziness, nausea, fatigue being the most common, but ones that are transient and then and give you a really powerful, non-ordinary consciousness experience, a psychedelic experience. Then they kind of land back in the room, and then their care team are there to reflect their experiences and try to build something meaningful. They have integration afterward, and then they repeat. One journey, one experience is enlightening, but really to make a change. If you're truly stuck in a place, you have depression, you're looking to make a meaningful transition in life, we recommend doing 3 to 6. So the offering really is that model of repeating journeys, treatments, using our workbook to reflect and journal, being asked to do certain meditations and self-reflection exercises to deepen your relationship with who you are, and then unpack and really realize who you are and who you're not, and then make decisions to do things differently. But really letting this medicine inspire you and create some powerful momentum to shift you into that growth phase.
Yeah. I didn't, I had no idea what to expect. And the funny thing is that, when I got there, I did it on Friday and today's Monday. So it's only been a couple of days since my trip on ketamine. You said, okay, I'm going to do the injection. I had the intramuscular injection. What's different between that and the IV? In terms of like the experience.
They're very similar.
Okay.
We could talk about how the subtle differences, but IM will all the medicine goes in your body at the same time. So you have a really fast onset and a fast spike. So you have this experience of shifting into non-ordinary consciousness within 3 to 4 minutes, 1 to 3 minutes. With IV, and then I'll finish that. So it peaks in less than 10 minutes, and then you slowly kind of come back down over 40 minutes. And it's more of a sharp ascent and a gradual descent. With IV, if someone's really nervous about it, we can titrate it much more slowly. So you can enter, rather than entering over 3 or 4 minutes, you can enter over like 10 or 15 minutes. So you can gradually go in. If someone gets very nervous about it, we can pause it or stop it, and then it'll all turn off. But what's also really nice about it is, rather than having this arc where it's a sharp up and then a descent down, you can kind of get to a plateau and stay there. So once it gets beautiful and really expansive, you could stay at that same place for 30 or 40 minutes and then come right back down. So it's more of a plateau versus like a spike and a descent.
Okay, that's interesting. I might want to try that. So this is how I, you gave me the injection. You said I'd have probably 5 minutes, but I feel like it just knocked me out completely. So my feeling was and I don't know, I want your thoughts on this. I feel like I was put to sleep and then I woke up in my ketamine experience. Do other people say that? Have you heard that before?
So it felt like you quickly left, and then actually you lost your memories around that. And when you came back into your memories, you were, or in a sense, you were in that dissociative state.
I was I think I had more of the out of body experience where I was watching myself in the state. Does that make sense? That I was separated from my body, so my body was paralyzed. You know when that happens sometimes when you're sleeping, how you go into that place where you're half awake and half asleep?
Yes.
That's how I felt.
So it felt like right away you separated, but separated such that you kind of can't remember that part because you said you were asleep.
I feel like you said, and I'm going to ask you if you want more, right? Yes. And then you'll be able to tell me, just squeeze my hand or something if you want more, or say yes or no. Well, I don't remember any of that. So I felt like I felt it coming on really strong when she did the injection. I think I fiddled with my eye mask and put my head down, and you told me to take a breath, and I was out. Similar to when you're put to sleep, right?
Yes.
Yeah.
So what'll happen with so on your first round, we have to kind of gauge your dose.
Yeah.
So we're actually at a middle low dose of a higher dose of ketamine. So with you, but what your body will do is it'll have this powerful experience, but if we slow you down too much, you may not have good memory recall. So the goal is to find the dose where you have good recall. Mm-hmm. It's powerful enough where you still feel that it's expansive and beautiful, and then you get to glide back down. What'll happen either over several rounds that we're going up a little bit and we're trying to make it more powerful for you, or sometimes in the first time because we don't quite know how your body's going to respond to it. If the dose feels such that it slows your body down so much, you might lose some of the memories around it. So I think what happened was, you went in pretty deep, and when you came back, you didn't start recording memories until minute 10 or 12, and that's when you started having the experience that you probably remember.
Yeah, which was, I was aware. This is how I felt. I felt like I woke up and I thought, oh, what's happening? Oh, okay. Yeah, I did the ketamine. You know what I mean? Like this is my trip I'm on. And wow, I'm paralyzed right now. I couldn't move a toe. You know what I mean? But I knew I was okay. You know what I mean? I wasn't scared. And then I'm like, okay, I'm just going to be here, And it was, I don't know, you had the music in the headphones, right?
Yeah, so you had an eye mask on, so you don't see and look at stuff.
Right.
You have noise canceling headphones, so that it becomes like an invisible guide, so that the tempo and the cadence of the music kind of helps move you through this space.
And that is exactly how I felt, because when I woke up, it was, not woke up, but when I felt like I was kind of asleep or maybe in just a deep state that I don't remember, right? Mm-hmm. And then I woke up and it was light and bright and moving and swirling and powerful, yet childlike and curious. And I had feelings of my twin sister with me, and my childhood. And it was a feeling, I didn't see anything, but the white and the movement of time and space, like I was traveling through a dimension.
And the components of a psychedelic experience are a few, and one of them is transcendence of time and space, and one of them is this sense of knowing, like this noetic quality of your experience, this sense of like where you're connected to something that you've always known, but it's hard to access.
Yeah.
And when we spoke afterward, some of those things came up. Tell me about that. When you were in that space, you were suggesting that it felt like you were a young girl again.
Yeah.
And connecting to your family at the time.
Yes, connecting with my sister and being really curious and adventurous and brave and having fun and feeling free. There was no visual. It wasn't like the street I lived on or anything like that. It was just white, moving, traveling through time and dimension.
And how is that an experience that's missing in your life? Is that something that you almost felt like you were craving?
Yeah, because I think my life got really serious really young, and I didn't have that time to play or extend my youth. It got too serious. I had to make money and support myself. You know what I mean? It got the playing just, I don't know, from I think a really young age stopped.
So how did you feel when you were a little girl on Friday? And how did you feel to connect to your sister in that way?
It felt really good. It felt like, that part for me was connecting with that part of me that sometimes I don't pay attention to. And so I liked it. And then it moved away from it, and I didn't want to leave it. I didn't want to leave that white space. It got a bit muddy. And the music changed, and I knew I was going someplace else, and I knew I had to, but I got a little scared in that moment of moving and traveling to, I can only describe it as a muddy place, a darker place. But again, I knew I was okay. I didn't at any time feel threatened by the process, or that, that I couldn't handle it or anything like that. So I was very aware the whole time that I was doing ketamine. Even though I couldn't move any part of my body or speak, I wouldn't have been able to speak. If I had to say something, I wouldn't have been able to say it.
Yeah, what's unique about this is that ketamine might be the most powerful psychedelic humans can use. There's a difference between a psychedelic and a hallucinogen. Hallucinogens are experiences where you have a visual experience. LSD, psilocybin, DMT are densely hallucinogenic rather, where you will see things. If you open your eyes, it's like AR. You'll see some colors and patterns on top of the background, or you'll see the background and it's moving up and down and melting together. Hallucinations are likely accompanied with a psychedelic experience, but they're not usually inclusive. A psychedelic experience, the definition of the word psychedelic is mind manifesting. So what it allows you to do is take your subconscious thoughts and animate them and bring them to life. And the reason that this is healing, the reason like LSD, I think, is not as healing or is harder to direct into a healing orientation is because it shows up the way it wants to, and it'll show you a lot of things. It's a bit of a shotgun. This is more of a sharper instrument, and the work around this we would start with this experience, and then I would ask you. So you connected with your younger self, your inner child. You craved it. It showed up for you, despite you thinking you wanted to see pretty colors. It showed up. You get the trip that you need, not the one that you want. So this is what this experience was saying. You need to tap into your inner child. Perhaps there's ways that you can look at your day-to-day and find that girl inside you and find that energy inside you that's healing for you. And the next step, when you connect with your coach, and if you were to connect with us again, is to keep exploring how that can be part of your life. And this is really valuable, not because you got that 5 minutes of blissful youth, but that you realize that blissful youth is still alive in you, and you can wake it up and bring it back into your regular life.
Yeah.
So
no, I see that. Yeah, I totally, even when I was in the process, I could see that. And then it moved to kind of muddy. And I did feel like the music was pulling me in the directions, to it transitioning from different spaces. And then the muddy part, I did feel my heart rate kind of go up, that feeling in your chest. And then it moved to another space of just feeling really powerful and knowing that I was really powerful. So that part was really good. And then all this seemed like a 5-minute thing, by the way, everything I just said. And then I started to realize I could move my toes and my fingers, and I could, that I was coming, or that I thought actually you were going to ask me if I wanted more. But it was Sheni saying, are you ready to come out? And so that was kind of funny because it seemed like no time had passed. So is that unusual, or is that normal, or do you just lose that sense of time?
Yeah, that's a great question. Most people will think that they had 5 lifetimes in there. and they'll say, I've lived, I had a lifetime, it ended, I was reborn, and I had 2 more lifetimes. It just depends on which experience. It sounds like with this first experience for you, I'd say maybe 10% of people have a experience where it feels really short. And I think the truth is you probably went in a little too deep. And it's not like too deep, like it was the wrong dose, but it was it was one where you lost a bit of the recall. So even though it happened, you couldn't bring it back with you. So on your next journey, we would actually go down and make sure that you can still get the value and the richness out of it, but have more recall.
Okay.
So I think that's why it felt really short.
Yeah. And then, I think that later that day after, I stayed for a little while and chatted with you and Chenny, and then Duncan came in, and I felt really just a sense of just appreciating my life and people in it and you and the experience. It really was I had a lot of gratitude. That's how I felt after. So,
there's a lot of people that come in and after a single treatment realize that they just needed to detach from that narrative of, they've messed up, and they're a disappointment to their family and their parents that aren't even alive anymore, and they're operating this narrative that they're a failure, or a classic male experience of this financial loss, and this is what it was supposed to be, but I did this. And as soon as they surrender and they let go and they have a dense embodiment of gratitude, relief, universality, and connection, sometimes that trigger is all it takes for them to start to reorient and have some sensitivity and tenderness back to themselves and start to say, this is going to be okay. So,
yeah, it was just like, I think for me, it was really validating in that I felt like I was exactly where I should be, doing exactly what I should be doing. Just, there was no question of my path, decisions, bad decisions, good decisions. It's all led me to where I am now. And I really felt that after this session strongly. And then I just kind of was a bit hungover by it, which I think is just me. I'm super sensitive to anything, just anything more than a glass of wine, and I don't feel good the next day. So I think that's just who I am. I don't know if it had anything to do with the treatment, but I felt it, a bit hungover from it.
Yeah, you can.
How long did that last for?
Well, I woke up Sunday feeling better. I was me yesterday, but yeah, just Saturday, Friday night and Saturday.
Yeah, everyone spins out differently. Some people, I'd say half of people say that it's pretty invigorating. And so they're almost immediately, they're inspired by their newfound clarity. But at least a quarter will have some nausea or lightheadedness, or choose to kind of take the day off the next day. It sounds like you fell into that camp.
Yeah, I was glad I didn't have to go to work or anything. That was good.
Yeah, when we do our an onboarding and preparation, we say, people are like, can I go to this meeting and this dinner? And I say, do your best. That day, absolutely take it off and do your best to really protect the following day. And if you can take that day off and the following day, then no one regrets it. And some people just use that time to integrate and do really pleasurable things, their hobbies, to spend time using that inspiration to do something pleasant. But if they have symptoms and they're a bit groggy or hungover, then even better, even more important that they have that time to recover.
Overall, I thought it was a really, for me to do something like that was just so huge. So I was so glad I did it. I think it does interest me a little bit to go back and do it a little differently and maybe be a little more present and not so out of body, if that could be done, if I could have that other experience.
First of all, we're proud of you as well. You know, everyone has some reservation, and you said it earlier. You're like, "Is that normal that I was nervous?" Man, I don't do this often. I do maybe quarterly in a therapy container, but man, I get sweaty palms and nervous, and try to chicken out myself. But this is really big work. So what you did is bold and courageous, and and good for you. And most people sign up for doing like 3 to 6 of these over 3 months.
Yeah, I could see why. Yeah.
And this will continue to unfold. This has only been a couple of days, and things are going to continue to unfold for you. On Wednesday might be the most profound day. It might be the day that something clicks and you realize, God, I get it. As a girl, I was this way, and I just spoke to my barista in this way, and I realized that that's what my mother used to do, and something will click, and you'll understand. You'll make a contrast between who you were last week and what happened to you on Friday will really start to imprint, and that's why we have the coaching to really make sure that you've got someone to witness and reflect this to you every week, and then you go back in, and this time you have this new intention. It's not about being a better productive person or getting these goals. Now maybe your intentions are about being more aligned with purpose, despite how it looks for society, or being more aligned with empathy and something in your childhood self. And you start to change what seems to be important and what your values are will keep becoming more and more clear. And then things start to, and each layer that you pull off gets you closer to the center. And when you get to the center, the people have these huge breakthroughs. And that's when the meaning really comes through, declares itself and really presents itself. The biggest cliches we hear in this all the time are, boy, this was 10 years of therapy in one day. Mm-hmm. Also, I didn't even know how much I needed this until the problem dissolved before my eyes, and they go, now I'm such a different person, and that can present itself in a moment, in 10 seconds, 6 weeks in, not in the middle of the treatment. The treatment is a catalyst.
Yeah. So what you're saying is that, and of course, I mean, I did keep asking you the question, and like, what do people experience? And you were very vague because you're like, it's ever different for everybody, and that I'm going to have my own experience. And I feel like I did, and it is what I needed. And just like for our listeners and people that are interested in ketamine but kind of scared, is that fear is it because it's all so difficult to really look at sometimes? Is that the fear? Like to really dismantle your life and what happened? And is that what the fear is? Or is it being out of your control, like getting the shot in your arm? And I thought we had 5 minutes and I would be able to go, all right, Remi, I'm feeling this and that. And I thought we'd have time to break it down and get me more comfortable. But I've trusted you so much. Like before I did it and you said, do you need to use the restroom? I was in the restroom going, I can't believe I'm doing this. Mm-hmm. But I totally trust you. And I just met you, and that's what that place brings. It brings so much trust. So the fear for me, I think, was not being in control and letting go. And and that's yes. And you are we are all human, but more importantly, we're all primates. We're all these animals that have to protect ourselves. And whether your parents taught you one thing and society taught you another thing, mm-hmm. we've all had to defend ourselves. And so the defense mechanisms and the walls that we've built have got us as far as we've got. We have to protect ourselves financially. We have to protect ourselves culturally against what other people will want to do to change us. We have to,
we have to, the things that have got us here have both supported us, but also harmed us. So people typically are afraid of letting their guard down.
Yeah.
And
It was really hard for me.
breaking that system, getting vulnerable. It's an incredibly vulnerable position but behind that wall of vulnerability is the richest content, that once you get into that, then you could live with more alignment, more authentically.
Yeah.
So is there now a therapy session or a follow-up session after what? That's
Yeah, I'm going to schedule one.
and
Yeah.
when do you do that one?
I was going to do it this week sometime.
Yeah, it needs to be this week.
Yeah.
I know you're. I saw you on the list of the people that need to be integrated, but we recommend certainly within a week, but we recommend closer to like 3 or 4 days from the treatment. So as things unfold and start to materialize cognitively, then you've got something to really discuss in a therapeutic container.
Mm-hmm. Okay, and then what happens after that one? I mean, you do this weekly until another trip. Is that routine? What's most common?
What's most common is someone is coming from a place where there's something specific that they're looking to work on. And it's usually related to an anxiety or an element of depression, something where they're stuck and it's a fixation. So I suggest doing 3 in a row, 1 week apart, choosing a time, Wednesday at 3 p.m., let's do 3 Wednesdays at 3 p.m. in a row. And with something like that, Karen, you did it on a Friday, so it's harder to capture you 2 days later. But if someone did Wednesday, then on 2 days later, on Friday morning, they'll have their integration session. And that way they have their experience, a couple of days to let it marinate in a sense, and then unpacking it, and then kind of the weekend to implement some of the strategies that they've determined might be helpful. And then they'll know they have a few more days after that, and they go back in on Wednesday.
Okay. Cool.
But, I feel like I'm working this out right now as we're talking. So sorry. But because little things come out, and then seeing you today, but going back to that place of the fear part of it before you do something like this, and then you do it. And it was for me about giving up control. I think the way I'm feeling like now today is just less scared in general. So not that I live my life scared, but life is scary, right? And we worry, and there's lots of fear. So I think it helped with that as the background noise,
So you're identifying that there's a lot that you don't have control over.
Mm-hmm.
And there's a lot of fear and resistance. And after having this treatment, you feel like you have more control, more clarity on those experiences, those emotions.
Yes. And I'm less fearful. Yeah.
So the next step is when you connect with your coach this week, she'll be able to pull that out, and just like I did in a moment, but really as you're giving prompts to start really navigate what your experiences were and what's the meaning of them. The next step will be to discuss how we can empower you, not only to use as a tool to look at what limitations were in your life due to fear and what you may want to do that you've been resisting, and describe what's possible for you if this were to keep growing and getting better, and actually coaching you into being future design oriented, designing the life not that you have to live, that you want to live, the one that you've always wanted to that you've craved, that feels like you're in abundance, rather than these little areas of scarcity that are creating limitation in your life. So, and doing regular therapy can also be powerful, but with this catalyst, you show up and you're already empowered. You already have all this material that's kind of hard to cultivate in a regular therapeutic relationship.
Yeah. It was great. It was a good experience. We have to chat quickly before we wrap this up about Matthew Perry and ketamine. And we talked about it before, but I want to just address it because our listeners might instantly go there in their mind.
Sure. Yeah, I'd be happy to talk about it. So Matthew Perry, do you have a way you want me to start?
No,
answering?
just talk.
So, so Matthew Perry did not overdose on ketamine. Matthew Perry, actually, let me start this different way. So, Matthew Perry is a relatively young individual. I think he was 53 when he succumbed. He had a difficult life. He had been, he had a bowel obstruction from overdose. He'd been in rehab several times. He was a known alcoholic. He had smoked. In the autopsy report, they found that he has significant coronary disease, some renal insufficiency, scarring in his belly from multiple surgeries, and it was obvious that he wasn't a healthy individual.
Right.
But the reason he succumbed was not from the isolated use of ketamine. He had a moderate dose of benzos in his system, clonazepam. He had Suboxone in his system, which is a narcotic which decreases respiratory drive, and he had a humongous dose of ketamine in his system, one that is probably in the order of 15 to 20 times the amount that you had on Friday.
Wow.
So if the level, I'm not looking at the numbers now, but
do you think he injected himself with it, or how do you think?
No, he can't. It'd be very, very difficult to get liquid.
Okay.
He did not have a prescription for ketamine. We don't have evidence, but the 99% of people that ever use ketamine buy it off the street, and it's a powder form.
Okay.
So he insufflated. He snorted ketamine. And when you take multiple agents that are sedatives, you will pass out. If he were on a couch and he snorted that ketamine and had these other sedatives on in his body, he would have just become unconscious for, 30 or 40 minutes, probably really decreased his respiratory drive, but woke up and been fine. He had a bad hangover, but he only died because he gave himself a general anesthesia dose of ketamine while in a body of water. So he fell asleep for 40 minutes, and you can only live for 8 minutes before you lose brain function when you're underwater. So he fell asleep in a body of water. I think one of the issues was he was also getting ketamine therapy from a practice in Los Angeles. So he was getting ketamine therapy, but he hadn't been to the practice for, I think, around 10 days. Mm-hmm. And it only stays in the system for a day and a half maximum. So he didn't have any ketamine in his system after his ketamine therapy, but somehow he had a humongous dose. I mean, the amount of ketamine would have lasted my practice for 2 weeks was the amount that he had in his body by himself at one given time. So the truth is, anyone that takes large doses, unsupervised, illicitly of a substance at a dose that's would never not be recommended, that be considered lethal or near lethal, could die, and that's just the nature of what happened.
Thank you for explaining.
And thanks very much for coming today. I think this will be a story that goes on for a while. Thank you very much for coming.
No, my pleasure. Thank you for having me.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.